and adjust it there. Good. How does it look now?
It's slanted.
Still looks slanted?
Yeah.
All right, let's take a look. All right. Okay. What I'm going to have you do is you're going to bring your hips towards me just a tiny, tiny bit. Good.
Does it matter if the feet aren't together or should the feet be apart?
So it will be easier for you to check for this if the feet are together. Okay, once you are sure he's straight, the patient can put their feet however is comfortable. And in fact, it is recommended that we have something like that sponge up there underneath his knees to give him some support. But for now, I'm just going to bring your feet together. Bring your legs together, nice and straight. All right, does he look straight on the table?
Yes.
Yeah.
I think so. I think that looks a lot straighter than before. So, I'm going to take this sponge here. Would you bend your knees up, please? And slide this under. All right, back down. Thank you. So, step one, get the patient straight on the table. MSP should be lined up with the midline of your table. What is step two?
Move the tube.
Move the tube. In which way should we move the tube?
To the center of the table.
Okay, so when we work with the table, we are going to once again be locking laterally. Be careful, there are two locks up here, right? There's one over here. Away from the wall is our wall unit. The one closer is our table unit. Be very careful which one you lock to. If you bring this over and you lock your machine and you do not see any more strips up there, you have locked to the wall unit. If you bring this over and you lock it and you do see something up there, right? Now you're locked to your table unit. So be very, very careful which one you lock to. So we are now locked laterally. What is our next step? What does it say under this? What is our next step?
Flex the legs slightly on. Make sure there is no rotation in patient.
Okay, so we have our patient position now. He's lined up. We have a support underneath his legs. His legs are slightly bent. He is not rotated. What is our next step?
Place the cassette.
Okay, we're going to place the cassette. So for this portion, what you are going to do is you will take this tube, you will bring it here to the middle of the table. There is no lock. You are not going to lock it longitudinally. Instead, what you're going to do is you're going to take this tube and get this centered with your table bucket. So, 14 by 17, portrait, green strip towards the head. There's dot on the bucky. We're going to get this lined up with our tube. Okay, so we're going to take the tube, bring it here to the middle of the table. We're going to take our bucky, bring it down as well. We're going to get that laser lined up. Okay, so does everyone see that? We have lined up our table bucky with the tube. So that's our next step. Step one was to lock laterally. Step two is to put the cassette in and align longitudinally. Push that in. What is step three?
Position of patient.
Not yet, we're almost there.
Bring the tube down to 40 inches.
Good. We still have a red light. So we will bring this down to 40 inches. remember, this entire time we are going to be on detent. On the table, if you bring this down to 40 inches, it will also lock your tube at that height. So keep bringing it. And once I got to 40, did you hear that click? That was it locking me into place. It gives me a green light now. If you do not see this green light, it means that either you're not locked in up top, you don't have a cassette inside, or your SID is wrong. So now, tube is lined up with the bed and with the bucky. We are not going to touch the tube. We are not going to touch the bucky, and we are not going to move the patient anymore. So how do we line up the patient if we're not moving the tube, not moving the bucky, not moving the patient?
So the table.
The table. Now we're going to float our table into position. So where is our centering? Where do we put our central ray? Not on this one. This is slightly different. It's not 2 inches above.
It's at the iliac crest.
Exactly at the iliac crest. So once again, we're going to feel for the patient's pelvis, right? I feel something bony here. That's not the crest. That's the as is. You follow that all the way around to the side. Okay, here's the top. This is the iliac crest. So with one hand, I'm going to hold my position, iliac crest. The other hand is going to manipulate this table. Okay? So we're now centered at the crest, and then we check here, are we centered MSP? What do you think, son? You're right there at the head of the table. Does that look like MSP to you?
No.
It's close, it's very close. All right, if everyone else would come over and take a look. Does this look like MSP?
No.
So we are slightly off, right? If you take a look, light comes all the way to the side, but we have some shadow here. Okay? This line is a bit too far to his left. So from here, we're gonna make a small adjustment. Now, I personally find it very difficult to make small adjustments in this room. So what I do is, I have my marker. I put my marker, the middle of my marker right here, okay? So the center of my marker is at the iliac crest. Now I'm going to start moving my table. Alright, so let's see, let's try and get that, okay? Alright, so I think that shadow looks a little bit more even. Alright, but while I was doing that, I moved away from the iliac crest. Luckily, I have my marker here. So I'm just going to try and keep this here. But now I'm just going to slowly slide it back up to that point where I said my iliac crest was. Okay, and once I'm there, I'll let go. So, how does that look now for MSP?
Better.
It looks better, right? I'm still at my iliac crest because I put my marker here to mark my previous position. Okay, so if I just want to double check here, right? There's my crest, and there's my centering. So we're going from pubic symphysis up as high as possible. For smaller patients, this will catch diaphragm. For larger patients, you might need to do a second picture higher up to get the diaphragm and to get the full abdomen. For markers, which marker are we going to use? Yes, we will use the left marker. Where are we going to put this marker? If I turn this on, can anyone find me a good spot to put this marker?
Could you put it on the actual bucky itself? On the table?
Can we put it inside here? Good question. It's dangerous. You run a high risk of your marker getting stuck inside. So I do not suggest putting the marker on the cassette inside the bucky. So normally you want to leave it somewhere out here on the table by the patient. But if you take a look here on the left side, there's not much light to work with, right?
You put it on the patient?
So yes, we can put this on the patient. For example, down here is the hip. That's not part of our area of interest. That's not the abdomen. So we can just put our left marker right there over the hip joint. If you want it to be fancy, you can even tuck it in right here underneath the patient. Still at the hip, but now it's closer to the cassette, less OID. You could try and place it here instead, higher up.
Did the marker get lost in the patient's clothes then?
So yes, I have had that happen. I have had markers disappear with the patient, and I've had to go hunt them down. So this is somewhat dangerous. It's also dangerous because you do run the risk of the marker showing up inside the anatomy, inside the area of interest. For this one, I do recommend you put it just down here, down by the hip, on top, so it's easy for you to remember to take the marker off. Okay. We do have a male patient, so we are able to shield him. So, for this one, we are going to take our shield, and we're going to just put it right here over the gonadal region. Okay. We can even pop it slightly into the light field because this is where our pubic symphysis will be. But everything past here is going to be abdomen. So you do not want to put this shield too far up. Okay? So we have it here just covering his gonads and nothing more. Any questions about this? This is the most common type of abdominal exam. This is the AP supine abdomen. You will also hear this called a KUB, kidneys, ureter, bladder. Okay? Because you've got kidneys, ureter, bladder right there. All right. I'll just put this to the side for now.